It's estimated nearly 1 in 5 Americans suffers from mental illness every year. For patients who are mentally ill, mentally challenged, or who have a chemical dependency, their condition may include depression, anxiety, or maybe the result of family conflicts or other psychiatric illnesses. Catholic Health Services offers a vast array of behavioral health programs in one location. We'll discuss that on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone, and thank you so much for joining us. I'm Jane Hansen. Mercy Medical Center's outpatient clinic treats adults experiencing mental health issues and assists those with substance abuse issues. The center moved from Oak Street and is now located at a new shared location with Mary Haven's day program on Stewart Avenue in Garden City. Joining me is Dr. David Flomenhaft, the Director of Outpatient Behavioral Health Services for Mercy Medical Center. Welcome. Thanks so much for being here.
Glad to be here. Thank you.
I don't think we don't like to talk about it, first of all. We don't like to talk about mental health a lot. But secondly, I don't think people have any idea how many people are affected.
I think you're right, and that's why I'd like to take some time this morning to explain the context and how common these illnesses are. So I have a couple of slides that come from the National Alliance for Mental Illness that might help explain how common these illnesses are. You should know that 1 in 5 Americans suffer with some form of mental illness in any given year.
1 in 5?
1 in 5.
And the average diagnosis comes at what age?
So the average onset for illness is anywhere between 14 and 24 years old. Unfortunately, as I'll talk about later, there's usually a delay of almost a decade for some folks in getting treatment, and often for others even longer than that.
And what kinds of mental illness are you talking about?
So the types of mental illness, I'll show you on another slide. 1.1% of Americans, about 2.5 million people, suffer with schizophrenia. So that's among the most severe mental illness. Usually it's a brain disorder that affects thinking, social behavior, care for oneself. 2.6% of Americans are afflicted with bipolar disorder, which is a disorder that affects mood, either mania or depression. That's about 6 million people. And the most common mental illness is anxiety disorders that affects 18% of Americans, another 42% of Americans. And anxiety disorders comprise of panic disorder, OCD, post-traumatic stress, very common, for example, with people who have been affected by some kind of traumatic incident, survived it, and generalized anxiety, perhaps the most common mental disorder, and phobias, fears of social situations, in particular objects.
With those kinds of numbers, you have to be talking about a huge impact economically.
It sure is. So on another slide from the National Institute of Mental Health, depression is the leading cause of disability throughout the world. $193 billion in costs are associated with mental disorders in terms of lost productivity, absenteeism. 90% of those who die by suicide have an underlying mental illness. Suicide, you may be surprised to know, is the 10th leading cause of death in America, higher than homicide rate. So treatment for mental disorders is important, and it should be equivalent to treatment for physical illness.
So let me ask you this. It's hard for people to determine that someone they love or even themselves truly have a mental illness. It's frequently either misdiagnosed or not diagnosed at all, correct?
That's true.
So what do we do about that?
Well, television shows like this, education, assessment in the earlier grades would help throughout the school system. I think you're seeing the concern at the college level with assessing for suicide, depression, substance abuse disorders. These need to be addressed in primary care, and we need to help reduce the stigma of mental illness and substance abuse so that people can feel comfortable to approach their care provider and get help.
You talk about integration of care. What's that mean?
So integration of care has to do with another statistic I'll offer to you today, that people with chronic mental illness under treat or their medical conditions. So people with chronic mental illness tend to suffer from obesity, in part caused by the medications that are often prescribed, hypertension, diabetes, and their lifespan tends to be 25 years less than the normal population. So what we've done in terms of integrating care is integrate medical care, primary medical care, into our behavioral health treatment. So we have 2 internists that provide care to our mental health population.
And I know you have some things like creative art therapy.
Right.
So talk to me very quickly about that, because then I want to show some video.
Creative arts has to do with the use of different mediums, whether it's art and painting or drawing. We even use iPads for people that want to draw through that medium. In addition, our art therapist also has a service dog, and that service dog, we call him Dr. Glenn, provides another support, another tool for us to get clients comfortable in our setting. So we have an open art studio 2 days a week that allows patients to come and use different medium to facilitate the healing process.
Well, we were lucky enough to have our crew visit some members of your team as well as your new neighbors at Maryhaven to discuss what they offer and how they collaborate. So let's take a look at that.
What's unique about our program here is that we have different type of services under one roof. We have the mental health clinic for psychiatric treatment, the substance abuse program for patients with addiction. We have the medical services, and we also have a higher level of care partial hospitalization program for patients who might need a more intensive kind of treatment. So having all those programs under one roof, it's a big advantage. Like patients can move from one level of care to another according to their needs. In terms of this location, having Maryhaven as a program next door, this is also added another dimension to the services we can provide to our patients, a place for them to go and work on improving their skills in terms of daily life and their functioning.
We're involved in the partial hospitalization program, which is an outpatient program where the patients attend 5 days a week. They are here for the day, but they do get to go home, stay with their families. It serves primarily as a bridger from inpatient hospitalization to living back in the community.
The partial hospitalization program is so important because when you're stepping down from such a high level of care like an inpatient psychiatric hospital, you want to make sure that you have the support around you, that your family understands what's happening, that the patient understands what's happening. So we gently guide them through that process, making sure that they're on the correct medication and really that they're safe and stable within the community.
I am the licensed creative art therapist here at Mercy Outpatient Services. I work with 3 of the 4 different programs that we have here. Partial hospitalization program, chemical dependency program, and clinic patients. We offer a variety of types of art therapy groups. 2 of them with chemical dependency and partial are more theme-oriented, where we do more psychoanalytic kind of art therapy. And we also offer an open art therapy where people can kind of come in and just explore their creativity in a less restricted kind of way. They don't have to come. The other groups are more, they're assigned to the groups. We also have a lot of different types of art that patients can do. We have iPads as well as all the other traditional types of medias. We also have canine-assisted therapy that we integrate into the creative arts program. This is Glenn. The patients often call him Dr. Glenn, and they make appointments with him. Glenn, lap. I also teach them how to handle the dog, and they get a sense of success at learning a new skill. And he's very lovable and calms patients down and just gives a nice atmosphere to the art room. The creative arts therapy program is really important here because a lot of the patients can't express themselves verbally, and this gives them an opportunity to be seen and listened to in a different type of way. Patients can also interact with each other in a very different and unique way by viewing each other's artwork. It's a great way to socialize, it's a great way to get insight, and it's a release of emotions.
My name is Tara Lang. I'm a licensed creative arts therapist. I work for Mary Haven Center of Hope, their PROS program. I run a variety of different groups. I work as a primary for some of the individuals, and then I run mostly art groups. I do run some like leisure planning and social skills type of groups. We have about 120 to 130 clients who come here. They come for a variety of different mental health reasons. Some have schizophrenia, some have bipolar disorder, major depression. I think we're already seeing a benefit to the being co-located with Mercy's clinic, because some of their clients have already started to transition to our program, and I think being in the same building has helped overcome some of the stress of starting a new place, that they're actually just walking through a different door, to come to our program. And the one particular client that I have today, he said it's working out nicely for him. I think he was a little apprehensive at first, but he's enjoying the two programs. He continues to go to both programs.
So we're going to talk more about some of those programs a little later on in this show, but what I wanted to ask you about is the use of drugs, psychiatric drugs, to help people. How many people are actually on some sort of a psychiatric drug?
In our behavioral health treatment program, about 90 to 95% of the people are on some prescribed medication. These are a tool in the treatment of mental illness, but what we know is that medication in concert with talk therapy is really the most effective treatment. And a recent study that was recently in the New York Times demonstrated that for early onset schizophrenia, talk therapy and low-dose medications are the most effective treatment for positive outcomes in terms of giving people support, education, and giving their families an understanding of how to help them cope with what are, for most folks, chronic conditions.
And helping them to live some sort of a fairly structured and yet very healthy life.
That's right. But for the most part, these are brain illnesses, so medication is an essential part, component of the path towards health.
All right, thank you so much. We have to take a quick break, but our discussion continues with more information about CHS's care for behavioral health issues right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Mary Haven Center of Hope assists children, adults, and senior citizens with disabilities by offering programs and services that focus on the potential of people with special needs. The professional staff helps people build confidence, improve self-esteem, and assists with community integration. Joining me now is Mary Ellen Conrad, the Director of Nassau Day Programs and Supported Housing for Mary Haven Center of Hope. And thank you so much for being here.
Thank you very much.
Welcome. 35 years you've been helping people with these kinds of special needs and mental illnesses. Give me an overview. Is it different now than it used to be?
It is different. First of all, I think more services are on the outpatient basis rather than on an inpatient. When I first came to work, people would be in a hospital for 3 to 4 weeks and then come to us. Now, if they're coming from a hospital, they've been in the hospital for 5 to 7 days and then coming to us. And also, we have a little bit less stigma than there used to be. People aren't quite as afraid to say, I may need help, whether it be in a day program or clinic or another service in the community.
So that's good, but there's still a ways to go?
There's always a ways to go. There's always going to be the stigma when there are episodes in the disasters in the community. The first thing people say is, was the person mentally ill?
Oh, yeah. I know what you mean. So we just showed some video from Mary Haven, and we talked about this great collaboration that's going on. How does that work?
Yeah, we have a dynamic synergy. We're going to be able to, in the future, next several months, access medical services, which are offered through Mercy Medical Center for our clients who come to our day programs, which is a phenomenal addition to our programs because our clients often have difficulty accessing those services in the community. Transportation can be a barrier in the Long Island region, so that they will just be able to go next door and access some of those medical services right on site.
It's kind of the little things we don't think about. Transportation seems so simple and so obvious, but if you can't get there, you can't get there.
Absolutely, and we have really just the buses, and we don't have a true mass transit system, so it does present a barrier for a lot of our clients.
So let's talk about some of the other programs. Horizon Pros, what is that?
Okay, that's a day program. We opened it in 2010. It's called Personalized Recovery-Oriented Services, and it's a program where people come to develop their own independent goals. Each person has a personalized goal plan. For some people, it's going back to work. For some people, it's skill development to maybe move to an apartment or live independently. And for some people, it's just getting back into the community after being isolated, perhaps by life's choices or by illness. So we have been very successful in helping people to achieve their goals and move on to better things for themselves.
What about Drop-In?
Drop-In is actually an additional program that's hosted in the building. It's a social and recreational program for people 18 and over. So someone can actually be coming to Pros 2 or 3 days a week and then come in an extra day or two to be part of the social and recreational program. We do activities right on site, as well as go out to explore community activities, resources in the community, libraries, public events.
Things like that. And then I know that you just talked about the social and recreational program. Is that the same one that's aimed for adults over 55?
It is similar in nature, but that program is, we have found that for that program, people have been maybe in treatment for many years, and they've really actually maximized the benefit of a day program, but they still need that social connection. It's very often, as we age, there's a little bit greater social isolation. So for that program, we do more activities that are generational specific, and some days of the week we do intergenerational activities between Drop-In and Senior Network, so that they'll play volleyball in the chairs and things of that nature. So it's been a great collaboration for both of those programs to co-locate in the same building as well.
And now I know you've got a new state-funded program called SOAR.
Yes, and SOAR is a little bit different than the other 3 programs in the building. It's an engagement program. It's meant to engage people who may not know exactly what they want to do, what do they want to set goals yet. So we have the opportunity to work with them in a smaller group setting. It'll generally be less than 10 to 15 people coming to the program, and we have the opportunity to help them to define what do they want to do and also to decrease their reliance. For some people, if they don't have a program or they're new to the mental health system, they wind up going to the ER on the weekends, after hours, going back into hospitals. So we're looking to engage them into a community-based activity and program that is specific to their individual needs.
It sounds like you've got an awful lot of programs and resources and all kinds of things for people to participate in. How does somebody find out about them?
Well, there's a master guide. We have a website, for CHS, and Mary Haven has its own Facebook page. So those are some of the ways. I go outside and I do marketing, at public meetings. We participate in many coalitions, so we also, market our services that way. And when I say market, it's really educating. And then we sometimes just receive that phone call that says, I have a family member and I don't know what to do. And we always take the time, because that time is time well spent, and it demystifies the mental health system, which can be very daunting when someone is newly diagnosed.
I'm sure it is. Thank you so much for everything
You're
that
welcome.
you do. Appreciate it. We're going to take another break, but don't go anywhere. There is more. CHS presents Lifestyles at the Heart of Health right after the break. Welcome back to CHS Presents Lifestyles at the Heart of Health. Mary Haven Center of Hope offers numerous day programs designed to give individuals the opportunity to use their skills through areas of study and needs that interest them. Joining me now is Carol Meseta, a client from the Mary Haven Day Program. Welcome.
Thank you, kindly welcome.
Thank you very much for being here. Now talk to me a little bit about what Mary Haven brings to you. What do you do there, and how has it changed your life?
Mary Haven offers me hope, It offered me hope when I was first part of a program, and it continues to offer me hope now. It allows me to interact with my peers. It allows me to learn and to grow personally.
When we talked earlier, I know that you said that you believe you had some sort of depression or mental illness as a young person, but it was never diagnosed. And then it just, got much worse when you were an adult.
That is correct.
And so how did you end up actually having it diagnosed?
My son and I were living in Texas at the time, and I had begun isolating before we moved from New York to San Antonio. While in San Antonio, I became very, very ill. I became suicidal. I isolated. My husband's brother and his wife took my son in, who was 16 at the time, and they let him live with them. I was diagnosed finally about a month after I moved back to New York.
And with that diagnosis, what is the diagnosis, if I can ask?
That's quite all right. My diagnosis, I'm bipolar, I'm type 1, I have depressive tendencies.
And so for all those many years, you lived without any kind of help?
That is correct.
Go on.
I was always able to pull myself up and out. It wasn't so bad that I couldn't get over it, so to speak. I managed to take care of myself, and I managed to take care of myself because of my son. Mm-hmm. Because I was a single mom raising my son.
Because your husband had died of cancer. Do you think that that might have traumatized you to become even worse after that?
No, I don't believe so. I believe it may have added to it, but I don't believe it was the cause.
So believing now that you really had some mental illness as a teenager, do you wish that you would have gotten help then?
That's a very difficult question to answer. I'm not sure. If I really do wish that I had gotten help then, my life would have been different. And as I see it, it played out the way it was supposed to play out.
Mm-hmm. Because I guess one of the reasons I ask that is because earlier in the program, we heard a statistic that a lot of mental illness begins between the ages of 14 and 24, but most people aren't diagnosed until at least a decade later. Mm-hmm. And for you, it was 20, 25 years later, or even more. So I guess for our audience, I'd like them to know that it's okay to get the diagnosis when you need to get it.
Absolutely. Absolutely. Don't be afraid to get that diagnosis. It is not weak. It is strong to ask for help.
But do you feel like a lot of people still stigmatize it?
Yes, absolutely.
So how do we fight that?
Education. Education. Shows like this and education. Mentally ill people, for the most part, are not dangerous. We just want to be accepted into the community.
And the programs like you're in at Mary Haven help you socialize. They help you learn some skills. Mm-hmm. And it enhances your life.
It does. It does. I run a peer support group at Mary Haven twice a week, so that my peers can come to this group, come to me, and if they have a problem, if they need to discuss something, we discuss it, we talk about it, we give advice.
Mm-hmm. What would you like the people that are watching this to know about you and about how they can help, maybe people in their families or even themselves? What should they look for? How can they help?
They should look for someone who is suddenly not acting the way they used to act. They should look for isolation. Isolation is a big part. They should look for somebody whose personality has become a little different.
And all of those things, happened to you, and
yes,
life has been better since you got diagnosed. Is that correct?
That is correct.
And why do you think that is?
Because I got the help that I needed. I had come to a point in my life where I was sleeping probably 22 out of 24 hours. I had been in and out of Nassau University Medical Center, and finally it was suggested that I go to a day treatment program. And the first day treatment program helped me immensely. Mary Haven has helped me more. I have goals, I have hope, I interact with my peers. I believe I'm well respected among my peers.
Well, you certainly got my respect for showing up here today, because that's a very brave thing to do. I'm going to invite our other guests to come back on the program, and I know that Mary Ellen has known you quite well you've been at Mary Haven, and so I guess what I want to do is, Mary Ellen, when you come back on here, I want to ask you about Carol. You must be very proud of her.
We're very proud of Carol. She's done an incredible job, and Carol's actually now pursuing becoming a peer specialist. So she'll get a certificate, and we hope to then hire peer specialists within our program. So we hope that Carol might be a candidate for that.
And you, Doctor, obviously see somebody like Carol who's finally gotten the help that she needed, and look at her now. That must be rewarding to you.
She tells a wonderful story of perseverance and dedication, and hopefully we can spare others that delay in getting care, so they don't have to white knuckle it through even more milder forms of mental illness, of anxiety or depression, so they can get care, support, and the community that Carol now has with others.
So last words for the people out there, Carol? Get educated?
Get educated. Get educated. That's where stigma ends. I didn't really care about mental illness until I became mentally ill. And we see it in the news all the time, violent mentally ill people, but we're not violent. We're not violent. Learn about us, who and what we are.
Thank you so much for sharing your story. We really appreciate it. Thanks to all of you.
Thank you.
And of course, for more information or to schedule an appointment at Catholic Health Services, 6 outstanding hospitals, or access any CHS service, you can call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us today. I'm Jane Hansen, wishing you goodbye and good health.